For most hospitals, advanced imaging stops on weekends and holidays, creating patient backlogs and delaying critical diagnoses. That ended January 1, 2026. A permanent CMS rule officially authorized virtual supervision for diagnostic imaging nationwide. This isn't a minor policy update. It directly meets the massive, documented demand for urgent imaging outside standard business hours. Critically, this new model presents a powerful answer to the nationwide radiologist shortage that currently cripples patient flow. So will this create 24/7 access to imaging? We'll map out the operational, financial, and patient care transformation. First, the access problem. Rural and underserved areas are hit hardest by the radiologist shortage, forcing patients to delay care. For any facility, providing on-site radiologist coverage during off hours is prohibitively expensive due to high salaries and overtime. This demand also contributes to radiologist burnout. But if the doctor isn't physically present, how is patient safety guaranteed? The direct result is clear. Patients wait longer for a diagnosis. These delays can lead to increased anxiety and poorer outcomes. We face a specialist shortage, unsustainable costs for off-hours coverage, and negative impacts on patient care. This demands a new model. So what does this new model look like? CMS is specific. It requires real-time two-way audio and visual communication, not just a phone call. The key to off-hours service is the one-to-many model. A single radiologist can supervise contrast studies at multiple sites remotely. This fundamentally alters staffing. Facilities can schedule weekend scans, bringing in virtual supervision for only the hours they need. This transforms a fixed overhead cost into a flexible expense. You pay for supervision only when a contrast study is being performed. Modern virtual platforms are built for compliance. They automatically log every supervision event, creating a clear audit trail. CMS rules and ACR guidelines make compliance challenging, but platform-driven virtual contrast supervision has the answer. Small and large imaging centers are adopting virtual contrast supervision and are beginning to see benefits. The data backs this up. An RBMA survey shows nearly a third of centers using virtual supervision report faster response times. This model can also raise quality. A general technologist on-site can be supervised by a remote subspecialist for complex cases. These proven benefits in efficiency and quality are why facilities can confidently use this model to extend their service hours. Finally, the impact on radiologists is significant. Remote work and flexible schedules are powerful tools in fighting professional burnout. The model is efficient and effective, but the most important question remains, is it truly safe? Let's address the safeguards. Evidence suggests virtual models can maintain or even improve safety through standardized protocols applied across an entire network. To answer our earlier question, in an emergency, the rule is absolute. A licensed medical professional must be physically on-site. This creates a two-part safety net: immediate virtual access to a diagnostic expert, plus immediate physical access to a medical responder. Of course, success hinges on proper implementation. This requires dependable technology, clear protocols, and rigorous team training. So, how do all these pieces, regulation, technology, staffing, and safety, come together to create our 2026 reality? Let's connect them. The CMS rule we opened with is the starting gun. This regulatory certainty drives adoption of the one-to-many supervision technology. This efficient model directly addresses the radiologist shortage. A smaller pool of specialists can now have a much wider clinical impact. Finally, the flexible cost structure makes it profitable to meet the huge patient demand for after-hours imaging. The financial barrier is gone. You have a green light from regulators, powered by efficient tech, solving a workforce crisis, all funded by a viable financial model. This transformation is driven by three forces: definitive regulatory change, mature technology, and immense operational pressure. These factors are converging to make imaging services on weekends, evenings, and holidays the new standard of care by 2026. The outcome benefits everyone. Hospitals save costs, radiologists gain flexibility, and patients get faster, more convenient access to care. For healthcare leaders and administrators, the question is no longer if, but how. The time to design your strategy for this reality is now.